physical therapy.
Alright, so how do we promote health and wellness to the older population? We'll find out. But first, we should do some PT assessment and intervention. So the ACSM physical ability classification gives three identification of the following continuum. Number one is the fit and elite, which are the 5% of the population. They are highly active adults who are in their old age. There are very few of them. Next is the independent adults of geriatric population. They're fully functional. Decline in physical activity, it will lead to their frailty. So there's 70% of those, the independent population. Lastly, we have the dependent and the frail population, which is the 25%. They need assistance with basic ADL. For older people wellness intervention, we can screen them with a PARQ, PARQ. And if there are risks identified, medical assessment may be recommended. For maximum benefit for the older population, they should be individualized, progressive, in long duration, and they could exercise in a group. There's also risk factors. There's the intrinsic and extrinsic risk factor. And we should address all modifiable risk factors. So there are like 1, 2, 3, 4, 5, 6, 7 risk factors, and we will discuss how we would manage them. Number one risk factor is the previous falls. The intervention for that is to modify the home environment and have some home safety evaluation. Number two risk factor is the use of medication. So we could collaborate with the doctors so they could reduce the medication when appropriate. The number three risk factor is the visual acuity. So we could address that by using adequate lighting and referral to ophthalmologist and optometrist. Number four risk factor is the postural blood pressure. The management for that is checking the medications, wearing some compression garments like stockings, compression stockings, decrease the sodium intake, and implement compensatory strategies. So, strategies like having slower transfers so that they can avoid orthostatic hypotension. The fifth risk factor is balance and gait, which could easily be addressed by balance training. And they could be referred for assistive device training. The number six risk factor is the decrease in proprioception, cognition, and muscle strength. So it is managed by raising attention to the deficits and by incorporating cognitive program as needed. And the last risk factor is the musculoskeletal exam with emphasis on lower extremities. So that is addressed with an intervention of strength training, flexibility, stretching program. So we should emphasize it emphasize the flexibility of dorsiflexion and hip extension. Alright, so there's a thing called functional fitness test for the older population. Functional fitness test, FFT. It is designed to assess independent living in older adults more than 60 years old. The emphasis of this is on the functional fitness. This test will see if the older individual can do the test without having fatigue. The goal is to identify weakness and treat it before it results in functional limitation. It is simple and comprehensive. The functional fitness test will test the muscular strength, the aerobic endurance, the flexibility, the agility, and the dynamic balance. The functional fitness test has 6 components. Number 1 is the chair stand test. It will test the lower extremity strength. Number 2 is the arm curl. It will test the upper extremity strength. Number 3 is the 2-minute step test. It will test the endurance. Number 4 is the chair sit and reach. It will test the lower body flexibility. Number 5 is the up and go. It will test the speed, agility, balance. And the last one is the back scratch test. It will test the upper body flexibility. What are the benefits if an elderly patient is active? There are health benefits. It prevents disease. There are psychological benefits like decreased depression, anxiety, and stress. He will also experience improved satisfaction and well-being. Another benefit is the functional status outcomes. It will improve their psychological well-being. And there's also social outcomes. It will give them a sense of involvement in the community. Special consideration: memory and cognition. Memory is closely related to intelligence and learning. Memory does not necessarily decline with age. Problem solving and learning may decline with age, especially in presence of pathology. Memory may be temporarily impaired with medication, depression, nutritional deficiency, anesthesia, allergic reactions, and electrolyte imbalance. This can be tested with a mini mental state exam, MMSC SE, as a screening tool. This tests the memory and the cognition. Memory and condition and cognition. Memory and cognition is related to risk of falls, home safety, and ability to follow through with the exercise prescription. Sample tests in the mini mental state exam. It will ask, what is the year, season, date, day of the week, and month. Number 2, it will ask, where are we now? Which state? Which county? Which town? Which city? Sometimes which hospital? Which floor? Another question is, the examiner names 3 unrelated objects clearly and slowly, then asks the patient to name all 3 of them. The patient's response is used for scoring. The examiner repeats them until patient learns all of them. And the examiner will see how many trials. Another question is, I would like you to count backwards from 100 by sevens. For example, 93, 86, 79, and so on. Alternative is spelling the word backwards, like spell the word backwards. Letter D, letter L, letter R, letter O, and W. Another question is, earlier, I told you the name of the 3 things. Can you tell me what those 3 things were? Another question. Show the patient 2 simple objects, such as a wristwatch and a pencil, and ask the patient to name them. Another question is to make the patient repeat the phrase, no ifs, ands, or buts. No ifs, ands, or buts. Another question is, take the paper in your right hand, fold it in half, and put it on the floor. The examiner gives the patient a piece of blank paper. Another question is, please read this and do what it says. What's written in the paper is, close your eyes. Another question is, make up and write a sentence about anything. The sentence must contain a noun and a verb. The last question is, please copy this picture. So basically, they make the patient draw an overlapping pentagon. And that is your mini mental state exam. The next thing you have is the special consideration in memory and cognition. We improve learning by presenting organized and straightforward information. We present information at an appropriate rate. We improve learning by choosing meaningful tasks that are applicable to daily living. We improve learning by implementing memory strategies. How do you have cognitive wellness? Cognitive wellness interventions include memory strategies, brain exercise like crosswords, reading, and word games, and you can collaborate with speech or cognitive therapy, neuropsychology as needed. Annual PT exam in the geriatric population. What are the benefits of an annual PT exam for the older population? Well, it identifies changes in physical function. It identifies reasons for referral like cardiovascular, pulmonary, and cognitive referrals. It provides an opportunity for patient education for risk factor reduction. So, we could have an annual PT exam for the older population. How about the wellness intervention for the older population? Well, there's the aerobic training. The aerobic training maximizes the cardiovascular function. It increases your energy. It increases strength, notably in the lower extremities. It decreases depression, and it decreases risk factors for coronary artery disease, diabetes, and hypertension. How do you train the older population with aerobic training? Well, the frequency should be at least 5 times per week for moderate intensity, or at least 3 times a week for higher intensity, and at least 3 to 5 times a week for combination of moderate and vigorous intensity. The bottom line, you have to do aerobic training for at least 3 to 5 times a week. And what is the intensity? For a scale of intensity, it should be in the moderate intensity. Like from a scale of 1 to 10, it should be in 5 or 6. For it to be considered vigorous, it should be like 7 or 8 over 10 for vigorous intensity. What's the time? How long do you do aerobic training? Well, the minimum for moderate intensity is 30 minutes up to an hour. So there's a quota of 300 minutes per week of aerobic training. If you want to level up, you could do the vigorous training, which is 20 to 30 minutes per day, for a total of 75 to 150 minutes per week. What are the modes of exercise? We can do walking, jogging, stationary or moving bike, upper ergometer, or aquatic exercise. And it should not give any orthopedic stresses to the joints. Another wellness intervention for the older population is strength training. Strength training is needed by the older population. Why? Because it increases the performance in activities of daily living. It prevents injury. It gives increased bone density. It prevents osteoporosis and osteopenia. It improves balance and coordination. It improves self-image and self-esteem. And there's a control of body weight. And there's an increase in lean tissue and decreased percentage of fat. So how do you give strength training to the older population? Well, you can do the resistance training for at least 3 times a week. For light resistance, you can do 40 to 50% of 1 rep max. And moderate is about 5 to 6 over 10. Vigorous is about 7 to 8 over 10. And then, what are the types of strength training you can do? Well, you can use dumbbells, 2-pound dumbbells of 8 to 10 different exercises, focusing on the major muscle groups of the upper X. And you can use 1 pound ankle weights on the lower extremities. You can give the patient progressive weight training and weight bearing calisthenics. Geriatric wellness intervention for flexibility training. Well, for flexibility training, if an older um, patient has flexibility training, it enhances the performance of activities of daily living. For example, the donning and doffing of shoes and clothes, the overhead activities, and reaching to objects on the floor. Flexibility training also improves posture, it prevents injury, it improves balance and coordination, it improves self-image and self-esteem. So, for flexibility training of the older population, it should be done at least twice a week. And the stretch should be held to the point of tightness or slight discomfort. Hold for 30 to 60 seconds. Hold it slowly and sustained. There should be no need for ballistic and rapid movements. Geriatric wellness intervention involving balance. Balance exercise for frequent fallers. So the balance exercise combines balance, agility, and proprioceptive training. It is effective in reducing and preventing falls. It should be performed 3 times per week. The general recommendation is it is progressively done with the difficult postures that reduce the base of support. There are dynamic movements that perturb the center of gravity, and it should stress the postural muscle groups. It should reduce and alter sensory input. For balance training, you should have some modifications and special considerations for patients with cancer, arthritis, diabetes, fibromyalgia, and others. And how do you have some special considerations for people with arthritis? So, since they're limited by pain, they should be given very light intensity. So, high intensity is contraindicated. And they should have adequate warm up and cool down. Mild pain after exercise may be present. So, if the pain persists, the intensity may be too high. For patients with cancer, we can modify the exercise based on the individual's cancer experience. Exercise is recommended during and after cancer treatment. It is often limited due to cancer-related fatigues. Consider immunosuppression and modify environments accordingly. Avoid exercising in public. Avoid the public facility. You may begin with lower intensity and gradually progress. For modifications for diabetes, exercise improves glucose tolerance and insulin sensitivity and reduces the risk for heart disease. So, there should be monitoring of blood glucose before and after exercise to assess for hypoglycemia. The risk of retinal detachment in the presence of retinopathy with sharp increase in blood pressure. So you be careful in resistance training because there's a risk of retinal detachment for patients with diabetes. So lastly is the patients with fibromyalgia. They often have decreased aerobic capacity, muscle function, and decreased range of motion. So exercise is commonly symptom limited. So to the point of pain and fatigue, we could stop with patients with myalgia. We could initiate exercise program with low intensity and progress slowly to avoid undue pain. That's how we are going to treat the older population with assessment and intervention.